Have you wondered if there's a surgery for your dizziness, vertigo, or Meniere's disease? Today I'm going to talk about one of the common ones that's done and whether you should do it or not. My name is Dr. Gregg Gerstin, and I have been helping people to remove the obstacles in their health for the last 20 years to lead amazing, fantastic lives. Today I want to share with you a little bit about a labyrinthectomy. So this is a surgical procedure that's done to remove the labyrinths within the ear that help to control or coordinate balance. Now this is done for people who may be suffering from Meniere's disease or have problems with dizziness or vertigo. And I gotta share with you, you gotta be really cautious with this procedure in any, because although the principle or thought of, if I have balance issues, removing the component that controls balance might be a good idea, the challenges with that is that, well, you use that for balance. So it can also lead to difficulties with balance. Even though it may be causing a problem, you might have problems with balance. There are other places you've got to look to understand where is the cause of the problem. There are other things that feed into your balance. Additionally, things that can happen are things like infection. Something that commonly occurs as well is that additional nerves that are right near the labyrinth in the ear can wind up being cut or severed. This winds up affecting one of your cranial nerves, the facial nerve. Now that controls the nerves on the side of the face that is affected. It also controls chewing and mastication. Really not very good things. These are bad things to lose and can cause a lot of problems. For patients who are going through this and having struggles, I really suggest that you make sure that you turn over every stone before looking at these surgical procedures, because they're absolutely permanent. If you've got questions about what other stones you should turn over before going into a surgery, let's connect and do a discovery call. On that call, we'll look to figure out what you've done, where you've been, and what might be the right next step so that surgery that could be very complicated is not the next step. If you've got more questions, go ahead and write them down below. Once again, my name is Dr. Gregg Gerstin, and thank you for letting me be a part of your health.